How does cognitive behavioral therapy work? An effective treatment method for a variety of mental and emotional health conditions, such as anxiety and depression, is cognitive behavior therapy, CBT. CBT attempts to teach you useful self-help techniques as well as how to recognize and confront unhelpful thinking. These techniques are intended to improve your quality of life right now. Anyone who needs assistance to challenge unhelpful beliefs that are hindering them from achieving their goals or leading the life they want to lead may benefit from CBT. CBT seeks to demonstrate how your thoughts impact your mood. It teaches you to have a more positive outlook on life and on yourself. It is predicated on the knowledge that it is ingrained in one to think negatively. The benefits of CBT. CBT is employed to treat a variety of psychological issues, such as social phobia, obsessive-compulsive disorder, and post-traumatic stress disorder are examples of anxiety disorders. Depression, unreasonable fears and low self-esteem. Substance abuse due to hypochondria, such as problem gambling or drinking, smoking, or using other drugs. Eating problems. Insomnia. Challenges with relationships or marriage. Certain behavioral or emotional issues in kids or teenagers. CBT is used to treat anxiety. Everyone has occasional anxiety. Anxiety acts as a type of defense and can improve how well you function under pressure. For instance, the spike in tension that frequently happens before a big race or interview can improve your performance. However, for some people, anxiety is a more pervasive sense. This means that regardless of what you are doing, you constantly feel on guard or afraid. This can be very upsetting and interfere with your regular life. It's crucial to start learning techniques for managing your anxious sensations if your degree of worry starts to limit your capacity to operate. CBT can be useful here. It focuses on altering thought and belief processes that are linked to and cause worry. When treating depression, CBT. People who are depressed may constantly feel bad about themselves, other people, and their surroundings. This negative thought process can become routine, making it difficult to recognize when you are passing unjust or unreasonable judgment on yourself. CBT can help persons with depression by equipping them with the skills to confront their negative thoughts and replace them with more rational and optimistic ones. CBT is also used to treat a wide range of other psychological issues. For the best outcomes, it may be advised in some circumstances to combine different modalities of therapy. Ask your doctor for more details and suggestions. CBT therapy. Depending on your condition, the specifics of your treatment may change. CBT, however, typically consists of the following. Assessment. This may entail answering questions to help you describe your specific issue and identify upsetting symptoms. Forms will occasionally be required of you so that you and your therapist can monitor your development and spot issues or symptoms that require more care. Personal education. To help you understand more about your specific issue, your therapist will give you written resources, such books or pamphlets. The axiom "knowledge is power" serves as the foundation of CBT. You can dismiss irrational fears with the aid of a thorough understanding of your specific psychological issue, which will help to reduce your anxiety and other unpleasant emotions. Setting goals entails working with your therapist to create a list of the outcomes you hope to obtain from therapy. For example, you may want to overcome your shyness in social settings. You and your therapist come up with doable plans of action to assist in achieving these objectives. Practice of techniques. You work with the therapist to put your new strategies into practice. To replace unhealthy or negative self-talk, you may, for instance, role-play awkward social settings or realistic self-talk, how you speak to yourself in your brain. You will be required to actively participate in your own therapy as part of your homework. You are urged to put the useful techniques you have honed during your daily life to use and share the outcomes with the therapist. The therapist might advise you to keep a diary, for instance.